All right, we'll get started. Today's topic, we're going to talk about myths and mental health. And I'm Nicholas Davenport. You probably already knew that. But basically, today's topic is pretty much something I feel not many want to talk about because there's a lot of thoughts on mental health. There's a lot of concerns, there's a lot of considerations, whether good or bad. And we're going to get into all that and unpack that. But I think the conversation hasn't been had enough. And I just want to go over some topics that don't necessarily get into statistics too deep, just go over what they are and what it might deal with and share some thoughts on that from my professional view, as well as some of my just personal experiences and opinions and what I understand. Those who don't know my background, I have an undergrad, a bachelor's of science in general psychology. I then did a master's in mental health counseling to be a therapist, but I only did a year of that, and I ended up changing to sports psychology, which I finished with a master's of sports psychology. So I have some clinical background, and then I did a doctorate in clinical psychology for a year, which I learned a lot about the pathology of different disorders, things of that nature, understanding interviewing patients or clients. So I kind of got a well-rounded look at this, and that's kind of what led to Mind Body One in itself. But those who follow me already know this, and those who don't, welcome. And this is my perspective, like I said, as a professional who works in the mental performance, mental wellness, mental health field from different dimensions. But we want to look at something more deeper into how these can get misconstrued. All right. So common myths. How I broke down this webinar is myths, stigmas, and colloquialisms. Now, basically, myths are just things that people think in general. Oh, people are this or that dealing with mental health issues, mental health in general. Now, stigmas are more so once they have the mental health issue or the mental health help, then people perceive certain things. And these stereotypes or these stigmas can be negative and can force feed what we already misconceive and make it even worse because now you're just running with something that you fully don't understand. And then colloquialisms, this is dealing more so making terms or concepts in the mental field, illness or just therapy in general, and generalizing them so it's more mainstream. And this can do a lot of harm. So we're going to go through a little bit of those. All right. So I'm just going to go through each myth, give a little description about them, talk a little about them, and then move forward. Now, common myths. So I'm gonna go through each one and then I'll unpack little by little. So, or I should say, I'm going to go through all of them and unpack each one little by little. So this is a non-exhaustive list. There's definitely so many more. These are just some I found interesting, some I looked up, some I already knew or thought of, some I've heard. So there's no like one size fits all to this. There's so many more myths, but these are the ones I chose. So let's go through them. Mental health issues are rare. You don't need therapy, just talk to a friend. Mental health issues are a choice. Mental health issues are strictly genetic and biological. You're just going to be prescribed medication. Therapy only gets into childhood issues. Black people don't need therapy, and eating disorders only affect women. So these 8 topics are just different myths that people have said or I've heard in passing or I've looked up. And the thing is why they're dangerous because most myths or stereotypes or whatever they may be usually aren't meant to be harmful. They're just something people believe. Like if you understand human behavior and just how the brain absorbs information, we like to fill in gaps. We have schemas. How do we make sense of the world and the environment around us? So these myths are really just ways to fill in those gaps of what we don't understand about mental health. So while I say it's not necessarily intended to be dangerous, it could do some harm. So the first one, mental health issues are rare. Now, I guess the question, if you do think this is, which mental health issue are you talking about? There's different types of mental disorders or different ailments that someone could suffer from. Now, yes, some are way more rare than others, but if you look at the actual numbers, like I said, I'm not gonna get too deep into statistics, but the actual numbers show about 1 in 4 people deal with one type of mental health issue, and it's actually the leading cause of illness or disability in the whole world. Because usually we think about illness, we think about physical issues, cancer, HIV, AIDS. Now we got the coronavirus. So we think about those things, but in actuality, it's an unseen like illness. You can't see. If someone has a broken leg, you more than likely can tell. They probably have a cast or they walk different. Or if someone has cancer and they're going through like some type of treatment like chemo, you might be able to tell. But with mental health, it's an unseen illness. You can look at me and not even know. I can look at you and not even know. And that's the issue. So that's probably why the misconception that mental health is rare is because people can't see it. But it does occur more frequently. You think about probably the most they say is like the common cold of mental health is depression. A lot of people say, oh, depression's a real thing. And a lot of people deal with it. severe depression, major depressive disorder. So we got to think about that. Other things such as anxiety, things like that, bipolar. These are things that people deal with more frequently than you think. And like I said, you won't know. And even if it's happening, you may not fully know. Because if you don't have context of what's going on, you just see it as abnormal or weird behavior and write it off and be like, wow, get away from them. But in actuality, they're dealing with this. So they're not rare at all. They're actually very, very common. Two, you don't need therapy. Just talk to a friend. Now, granted, having close interpersonal circles and friends and loved ones is very helpful for mental health, because we, as humans, we are evolved to work in a community and groups. Like I always say, my term, so I'll probably beat to death, there's no more saber-toothed tigers. While there isn't any dangers like that anymore, the groups we used to form back then, those ancient times, kept us alive. So our brain adapted and developed to be engaging with other people, whether it be friends, family, or loved ones. So having a friend to talk to is definitely helpful for mental health, it's dealing with stress, and it's always good to vent. But the misconception is therapy is just venting. You're not just sitting down on the couch, laying back like you do in the movies or TV and just talking nonstop about your problems. Therapy is not there just to listen to you. Obviously, that's a big part of the job because how can they help you if they don't listen? But they're also there to find solutions. So when we get into this frame of thoughts like, oh, you're going to therapy? You can't talk to your friend? You can talk to your brother? Like, yeah, you can, but one, are they trained for that? If they're not trained for it, that could be actually more harmful than good because venting, like I said, that's not what it really is. Yeah, you need to get things off your chest, but where's the constructive way to find the solution? The point of therapy is to have an end goal. Because if you come with a broken leg, using that analogy again, you go to the doctor, right? And what's the end goal? To get some kind of treatment, get a cast, get some maybe pain medication, and then tell you 6 to 8 weeks, do physical therapy, and there's an endpoint so you can walk better again after the leg is healed. Therapy should not be looked at any differently. If you go there with some type of current issue, whether it just be your daily life stressors or actual disorder, the end goal should be how do we mitigate these symptoms and how do we be able to get you in a better quality of living, wherever it may be. So talking to a friend is while it's not bad advice, it may be harmful in other ways. What if they don't have many close friends? Because we live in a world where we know, oh, I got plenty of friends or plenty of acquaintances, associates. Some people, unfortunately, do not have that, or if they do, they're not as close as maybe your associates and friends are. So that can be damaging too, because they think, wow, I have no one to talk to, and that can just add more insult to injury. Three, mental health issues are a choice. So this is basically this is what we call victim blaming, right? If someone gets hit by a car and breaks their bones, do you say that was a choice? They shouldn't have been driving the car? No, you wouldn't. Unless it was like something like reckless, like drinking and driving. And even then, well, that's just not the case. But if it's nothing reckless, you wouldn't put that blame on the person. Like even if I go even more extreme, if I say someone has cancer, are you going to victim blame a cancer patient or survivor? No, that's not right. But for some reason, when it comes to mental health, oh, what did you do to cause this? Or why don't you just get over it? It's like if you're choosing, why would someone choose to be depressed, severely depressed? Why would someone choose an eating disorder? Why would someone choose OCD? I'm guaranteed if you understand how severe these things can get, you would know that no one would choose this. And this kind of segues into even things like drug addiction. I worked in addiction centers for about 3 to 4 years in my career. And I dealt with people from all walks of life, from celebrities all the way down to people we call junkies. And what's the difference between either? Nothing. But people would always want to say, oh, you should just stop. Obviously, there's more to it than just shooting up or smoking, whatever it may be. There's levels to it. There's a behavior level of what makes them do their drug of choice. There's social levels to it, and there's definitely biological and chemical levels to it. And that's why therapy is always, we look at things from a multifaceted approach. And that's how we should look at this for the general pop. They don't get this because they think, I'm not living like this. So why are they living like this? But that's, I think one of the worst things we can do is put our minds in someone else's head. You can never feel the next man's pain. You can understand and try to sympathize, but can you truly empathize if you haven't walked through it? And then most people don't. While it is common to have mental illness, there's still a lot of people who don't even know they have it, or they don't even pay attention to those around them that have it. So it's like, we can never fully understand. So don't ever think it's a choice. If people could choose, they would choose. One thing they would choose not to, right? And I guess this segues into what I just said about mental and biological. So a lot of people on the other end, and I also heard this a lot working in addiction, is the opposite. Everything just strictly genetic and biological. I actually dated a girl once who was diagnosed with ADHD and anxiety disorders. So she would often tell me, and she knew my background. That's the funny thing. But her being someone at her age, dealing with her whole life in her 30s, and me being a professional, even though our professional we were dating, so she didn't see me in that light. And we didn't work out, probably mostly because of that, because she was one of those people who put it 100% on genetics. She was like, yeah, my mom, my dad, they did this. Oh, my chemical imbalance are out of whack. I'm edgy. And it's like, that's a part of it. But that's just one part of the framework. I always use my analogy when I'm describing different topics, like the race car represents the neuroscience of the brain. The cognitive aspects is the race car is the whole analogy. The race car is the cognitive aspects, how the brain works. The neuroscience is the engine, that's the physiological functioning, and the driver is the psychology of it. If you apply that same issue to mental health issues, the neuroscience would be the engine. That's saying your engine may not be the fastest, so that's having, say, a disorder. But do you just sit there and say, okay, I'll never be able to drive this car? No, but that's someone who puts it all on genetic factors and biological factors. That's what they do. They blame it all on the engine. But guess what? You still have other mechanisms of this car that can be improved. You still have the driver of the car can get better. So this is how I look at mental health. So when you pawn it all off on genetic, it's almost a cop out for the behavior side of it. So you can't go one way or another. You can't just be like, it's all behavioral, which there are people who argue that. There's a lot of people who get on Facebook debates and argue, is it behavioral? They should just stop if they're addicted. If it's that simple, why would we have addiction centers? And these seem pretty simple and straightforward how I'm saying them, but in actuality, it's not, because I've been in the industry over a decade and I've heard all these. People don't understand, and that's why I want to do these webinars for Mental May. Now, on the other side, biological people go that route. They just say, oh, it's only because of my chemistry, my neurochemistry. And that plays a big factor, but it's not the only factor. And it's like saying, you have that car, do what you will with it. How are you going to drive? All right. Medication. So this kind of piggybacks off of that. So if you're having a genetic or a biological factor, talking about neurochemistry, that's where medication comes in. And that's why I think a lot of people, at least what I've heard, faint away from therapy or psychological help because they think there's going to be a bottle with pills in it. Well, medication does play a role in some people's treatment. It may not be the best option for you. Or you may not prefer it and you might look for other treatments. That's the beauty of mental health. There's so many different ways to deal with it. Like I know for a fact in my career, before I got into do what I'm doing with Mind Body One, I worked in, like I said, addiction. I worked in a mental health hospital. I've seen the different ways people deal with mental health. So when we get this mindset, oh, this is going to give me a pill, I don't want to mess up my brain. Well, one, it doesn't work quite like that. And two, you decide what you put in your body. So don't get scared. But I guess this mental health myth is bad because people get scared simply for the fact that they think they're going to be force-fed medication and big pharma is going to do them wrong. And that's a whole other topic. But basically, we have to understand that it's more to it than that. 6, therapy only gets into childhood issues. So a lot of people brush off therapy for many reasons, but one thing I think has been misconstrued from mainstream media, pop psychology, pop culture is that it's that whole, how do you feel? How did your mom treat you? Your dad treat you? This is why the way you are. I actually had a client one day who showed me a YouTube or Instagram video of a lady who was talking about this, like the reason you are acting this way because this happened when you were a child. And I immediately pinpointed it as, oh, they're talking about attachment styles. A lot of people wouldn't do that, but this is my field. So I'm like, that's attachment style she's talking about. So I asked, is she a psychologist? She's like, no, she's just an influencer. She has like 500,000 followers. So I'm thinking like, that's part of the issue why these myths spread so fast, because we live in a world where people care more about fame and followers than education. So if you have a lot of followers, you're automatically knowledgeable for some reason, which you're not. Like, granted, if you're knowledgeable and have a lot of followers, that's great. But for some reason, say someone like Cardi B or LeBron James, they have 20, 30 million followers, that automatically qualifies them to preach on things that people with doctorates talk about, which is not right. And we got to get away from that. But that's kind of why these myths and issues get spread. And going back to the point of the attachment issues that people deal with as a child being the root therapeutic method is very wrong, because that you're going back to like the Freudian days, and people don't understand. Sigmund Freud is probably the most popular psychologist in the world, or psychiatrist in the world. He's considered the father of many forms of therapy. But it's like, you got to understand, things evolve. It's just like saying in sport, the methods they were using in the MLB and the NFL back in the 1920s is not what they're doing now. Those guys used to drink and smoke and do all kinds of craziness the night before the game, or even in the dugout or on the bench. We don't see that because they know now human performance is a big deal. So same thing with mental health. We've come so long since the early 1900s when Freud was in his prime. We learned those things and those set a framework. That's the beauty of science. We have the framework, but then we do empirical studies to get evidence to proceed on what was founded. So the foundations do have their role. I'm not saying discredit Freud, but to say that everything that comes back to your childhood is going to affect you now is, once again, these are cop outs, and these myths are very detrimental and damaging, because now I can say, hey, my mom didn't love me enough, or my dad didn't love me enough. This is why I treat you like this. Very toxic and dangerous to someone who could be better, right? But also the other problem with that is you're not understanding what therapy truly is. Once again, this is going back to like, oh, my mom was this, my dad was this. You're just venting again. In actuality, most therapists, there's so many different modalities, but one of the most popular is CBT, which is cognitive behavior therapy. And with cognitive behavior therapy, this brings attention to what you're actually doing and to relearn different techniques and cues so you can think in a different light. So if we go with the old, oh, my childhood issues, my rearing style, attachment styles, that negates the fact that we can even change, right? Why would that be dangerous? Because if therapy is the end of the goal is to find a solution, how do I find a solution? I'm being force fed these things. And a lot of people hear these things, and I hear them as a professional. And I know in colloquial terms that seems to make sense because that's not their background. They've been miseducated. But in actuality, we got to stop that. We got to open up. And that's why I'm doing things like this. We can open up the doors to what's going on. 7, I put this on here because it's near and dear to me. I'm obviously a Black man. I live in America. So mental health in the Black community is something that's kind of growing. I hear celebrities talk about it, but once again, it's more of that pop style of like, hey, we're about mental health. And that's where it ends. But what do we do with that? Like, I see people, I had a tragic incident happen in my community down here in South Florida. Whenever a kid I grew up with, we were a kid, he's a grown man, but it was a tragic incident where it was a suicide murder or murder suicide, and the whole community is shaken by it. And everyone was, just about 2 weeks ago, and everyone was posting mental health matters, check on your loved ones. And for a week, that was the narrative. But after that, it went back to regular scheduled programming, people talking about Dogecoin, Love and Hip, all the things that, typically talk about. And I'm doing this mental May, and it's like the participation of what I'm doing. And it's not even about just me, but I'm just saying because I'm only me. And it's like, that's where it stopped. And I hear a lot of people say Black people don't need therapy. You just could go talk to someone. Sometimes a friend, like we talked about, or sometimes a pastor. So religion, once again, it's a great tool. There's a lot of states that with spirituality and religion helping with mental wellness. But at the same time, that can't be the end all be all, because while a pastor has the best interest, he's probably educated in some form of counseling. Psychotherapy is not his field. CBT is not his field, unless it is his field, but more than likely that's not. Then that's where it gets harmful, because if you just told just pray about it, that can help and make you in a better mindset. Yes, it can. But when you leave it up to that, where's the responsibility and where's the solution? If I'm just waiting, where's my actual solution? We need a systematic and practical way to find these solutions. In the Black community, this is very prominent. Obviously, mental health is an issue for all. But in my community, where I grew up in, why I look in America, I'm big on that. People always say unapologetically Black. That's not just a word for me. It's what I do. And last one, eating disorders only affect women. So this one's crazy, or not crazy. This one's a myth that I feel is lopsided, because when we think eating disorders, we automatically think of probably one, which is anorexia. But there's other things that fall into this. And we talk about eating disorders. There's now binge eating disorder, people who eat in excess. There's bulimia, which is still in the spectrum of anorexia. And we deal with things that lead to that and things that are stemmed from they're comorbid, meaning there's other things going on. Like if I would say there's something they call manorexia, which is a body morphic disorder for men, which is specializing in muscle dysmorphia, which means they don't feel they're in shape enough. So they excess workout, excess dieting. They're always lifting weights, always going to the gym. They may even take supplements or enhancers, I should say, steroids, HGH, things like that. And saying that only affects women, it turns a blind eye. Now, are women the majority? Yes, statistically, women are the majority, but you can't, like I say, you can't live in absolutes. You can't live in a black and white world. It's always a gray area. Look at my Maduro Strong logo. Shouts out to boy Phil DeRue. But yeah, so we got to understand that eating disorders are something very serious in general, dealing with people's obsession with food, dieting, lack of weight. These things can be harmful, obviously psychological, but this type of disorder, more so than others, can end worse, because if you don't eat enough, you could do some serious physiological damage and even die. All right. So they're just a few myths. Like I said, there's not an exhaustive list. There's definitely more. Now, stigmas. Now, I think with stigmas, I feel this, like I said, this goes into the notion of they're still, I guess, kind of myths, but these are stigmas I put as in they're just a furthering of what people believe about people who deal with mental health issues. So the first one, people with mental health issues are crazy. People with mental health issues are violent. People with mental health issues can't work, and people with mental health issues are weak or lazy. Now, the first one, crazy. That's why I refrained on the other slide talking about crazy, because that word gets used a lot and I didn't want to associate it with this. So that's why I stopped myself. But people think mental health, people with mental health are crazy. So their automatic thought is someone who has mental health issues, they think of maybe the movie One Flew Over the Cuckoo's Nest. Like, that's severe psychiatric disorders. I worked in a place like that. So I've seen that. And is it something you want to call crazy? I say no, because those people can't, just like someone with cancer or diabetes can't control anymore how that disease attacks their body. While there is treatments and ways to help fight it, yes, but they can't control how it attacks their body. So can't a person with some kind of deep psychiatric disorder. But once again, what do we say? Most disorders aren't that. A lot of people dealing with disorders that that are more common, like depression, anxiety, things like that, which a lot of times you won't even know they're dealing with it. So to say that they're just crazy, yeah, in the media we see all of these people they call lunatics or in straitjackets. That's the extremes. Once again, black and white. There's always that middle gray area that takes up. But think about it. This is black and this is white. Everything in between that is the gray area. That's 99% of the area. So why do we only live in absolutes? So people with mental health issues aren't crazy, and those who have severe mental health issues, they're harder. But this goes into things we'll talk about later. People with mental health issues are violent, and I guess that goes back to the crazy thing. They think if their mental illness is making them crazy, they can't control themselves and go wild and hit people and break things. But in actuality, people are more likely to harm someone with mental illness. If you talk about people who deal with mental illness and they end up on the street, they're probably going to get harassed and picked on and harmed. And it's crazy because that's less likely to happen to someone who isn't like that. So to say that they're automatically inherently violent is a misconception. And that stigma comes from the fact that people assume that if you have mental health issues, you're just automatically psycho. And this is very, like I say, dangerous physically in this time. People with mental health issues can't work. Once again, not true. Going back to saying people with mental health issues are everywhere. Someone you know next door to you, your own family, your boss, they probably are dealing with some type of issue. They say, I still have a few statistics here, but they said compared to most, the employment rate uh, was only about 68% to 75% to people with and without. So without mental illness, the employment rate is 75.9%. Without is 68.8. That's 11% or I'm sorry, 7% difference. It's not a big significant difference, and that's just for mild. Now, people with moderate, that's 62.7, and then people with severe was like 24. But the thing is, that severe, once again, that's a whole other end of the spectrum. So this notion that, oh, they can't get a job done, can't hold down a job is wrong. And this makes people think if they're open, think if I'm open with my mental illness and I tell an employer, but hey, you got to be mindful of this. That employer might say, I don't think so. Maybe not say it to you, but they're gonna think in their head, I don't think so, and not hire you. And now you're out of a job because of a misconception. And the last one, people with mental health issues are weak or lazy. Couldn't be further from the truth. And if you think about it, these are some of the strongest people in the world. If we have mental health issues, think about it. We have to live in a world where you will never understand. But we also have to live in a world that you understand. And we have to toggle between both, sometimes controllably and sometimes uncontrollably. Now, think about how much mental wear and tear that puts on a person. So how much stress, how much pressure to have to withhold something that's a part of them. No more than your legs are part of you, your hair is a part of you. They deal with something that's going to put them maybe in a position where they're going to be weak in the moment, but they're not weak overall. That takes serious strength. And my hat's off, because people, if you're dealing with this, if this is you, hats off to you, because you're strong and you're doing what needs to be done to maintain this crazy world. I mean, it's crazy that time because we're talking about the world, and that's a crazy place. Now, the weak part, yeah, the lazy part, even further from the truth. I'm gonna put a few names, but I'm gonna rattle them off real quick. You might have heard of some, maybe not. But John Nash, late John Nash, he died about, I think, 5 years, 6 years ago, 2015. Mathematician. There's a movie actually about him with Russell Crowe called A Beautiful Mind. He has schizophrenia. Now, he's a world-renowned mathematician who's won some high accolades in his field, and he dealt with schizophrenia. Now, the movie, unfortunately, portrayed his schizophrenia in visions, which usually doesn't happen. It happens, but it's not the majority. Majority of schizophrenia is more so auditory, hearing voices, and he said that's what he dealt with more so than just people popping up out of nowhere. Um, Temple Grandin, she's a scientist. Her work dealing with animals and things of that nature. She had autism. She's probably one of the I'd say biggest names with autism because she was an adult that was open with it, and it gave this whole new light that this is a big deal. Because when people usually thought of autism, they thought about kids, and it's not like they just grow up and they disappear. This lady showed that, hey, I'm still here. I'm an older an adult, and I'm still dealing with this. And the fact that she's published hundreds of articles, done TED Talks, says a lot. Dan Aykroyd, Academy Award-winning actor. You know him probably from Ghostbusters and a plethora of other movies. He has Asperger's syndrome, which is considered on the spectrum of autism, kind of like it's higher level functioning. It deals with more so social cues, and that's not something most people are open with. Once again, but him dealing with that, he said, as a child growing up, it was difficult. So the fact that he still became an Academy Award-nominated and winning actor says a lot. The late great DMX rapper, we already know this, and he had bipolar disorder. His struggles led to a lot of things with drug addiction and things of that nature. And that's one thing I talk about when I worked at addiction centers. A lot of the addiction patients were dealing with they were comorbid, meaning dealing with another disorder. And that happens a lot. And Solange Knowles, the last one, she's a singer, ADHD. And her story is interesting. When I read about this was she went to two different doctors. The first time she heard the doctor, she didn't believe it. And she was like, screw this. This is not real. She really thought ADHD wasn't a real thing. She thought it was just something for big pharma to push pills. That may be true. Who knows? But when it comes to actual illness, when people push that something isn't real, you know how damaging that could be to someone who really deals with it? Like, you're just disregarding what they're going through completely. That's dangerous on so many fronts. But fortunately enough, she went to another doctor, and then it came through, and she finally believes in it. She deals with it now. And that's great, because when people of her status, like I said earlier, when you got a lot of followers, somehow you become educated. Luckily, she is educated, so she can do the right things, you know? Now, the last one, colloquialisms. So this deals with how we use mental health disorders, mental disorders, in a way that attends to how normal everyday talk goes. Like, if we say something like, I have a few, I'm just gonna read them. I can't stand messiness. I'm so OCD. Or I'm sad, I must be depressed. Or I lost my phone. Oh, I'm so ADHD. I change moves like night and day. You know, I'm bipolar. And I have a split personality. I'm schizophrenic. All these different statements I've heard so many times. You probably have too. Now, the problem with that is all of those are being used wrong. So when we use these as everyday slang or colloquialism, meaning just in a way that isn't based off what they really mean, as more in like in passing, is basically saying that it's common. And like I said, while mental illness is common, it shouldn't be treated commonly, if that makes sense. It's common as in it occurs more frequently than people think. But at the same time, it's not something we should treat with a grain of salt. So if I say, oh, I can't stand messiness, I'm so OCD. OCD is obsessive compulsive disorder. That's what it stands for. So when we talk about any disorders, this is something I want you guys to take home with me. When you talk about any kind of disorder, like I said, everyone deals with these different things right here. They deal with it to some type of extent. Once again, black and white, there's a spectrum. But there's something I want you to understand. You got to think about two main things: severity and duration. Those two big factors, when a psychologist, a clinical psychologist, or psychiatrist diagnoses, one of the main things you're going to look on all disorder criteria on the DSM-5 is severity and duration. How hard is it for you? How does it affect your life? The extremities of it, and how long does it last? Because if it only lasts a few days, you might just be going through a funk. You know, some people have bad days, and that's okay. That's normal. It's everyday life. But if it's just a regular Wednesday and you're just feeling like it's the end of the world, you're not taking showers, you're not brushing your teeth, you're skipping out on things you normally do, then you can say, severity. And then how long does it last? Oh yeah, it's been like this for 6 months. Duration, that's a long time. Then you can start getting to, oh, maybe I do have something, and you should get the help. Reach out, get the help you need. But if it's just a few days or even a moment, That's not this. And when you do that, it makes people really going through it. It makes it seem like it's nothing because you're going to think it's more common than it really is. And if I think it's more common than it really is, and not as severe as it really is, why would I care what people going through? Oh, I forgot my phone. Oh, I forgot to turn off the light. Because if you talk about OCD, people think it's just cleanliness. That's one part, but it's other forms. Nothing happens in black and white. So it's not, nothing is a vacuum. Everything has multifacets. So for example, OCD, I dealt with this as far as when I was doing my clinical training, and we learned all about this. OCD is just not, thinking you have to clean everything and be nice and neat and fix things. Because when you think of OCD, the O stands for obsession, the C stands for compulsion. Obsession means the intrusive thoughts. Keyword intrusive, meaning I can't help but think about this. It's always on my mind. So that right there probably negates you from even being that. That's just that. So if you're still following along, thinking you're still on this, let's continue. So not only is intrusive, obsessive thoughts, you think about compulsions. So compulsion is more of the rituals or behaviors that you use to mitigate those thoughts. So for example, if you think that the room is messy because there's a bottle on the floor, you pick up that bottle and put it in the trash. That's more than likely a normal way of going about it. Now, imagine if you left your house. I'll use a different example, but I want to paint a picture. You left your house, walked out the door, you locked it, went to your car door. You thought to yourself, wait, what if I can turn off the oven? You go back inside, turn off the oven, you lock the door. Wait, what if I don't do this? I gotta check my lock again, because every time in their mind they have to do it because it means that that thought will stay there. And to mitigate that thought, they have to do the ritual, which is checking your door and unlocking and checking inside 17 times. If you do it once, cool. That's not irrational. That's typically what some people do. I've done it. You've probably done it. But when you have to do it repetitiously, comes the problem. ADHD. I'm just going to talk about each one real quick before we wrap up. So ADHD is one that gets used a lot because it's usually containing paying attention, losing focus, or losing something like your keys or your phone. Everyone does that. That's everyday activity. But once again, severity and duration. If you do it every now and then, whatever. But is this hindering you from getting to work, doing your job, having relationships, being able to think clearly in a moment, picking up your room? That's when ADHD is an issue, because people don't look at that side. Because when people generalize these disorders, they make them sound cute. They make them sound fun. It's almost like people want to have anxiety disorders. People want to have ADHD. People want to be bipolar. There's nothing cute, fun, or cool about it. So people literally losing their jobs, families, and lives because of the severity of their mental illness. So for someone to be like, oh, I'm so ADHD without a proper diagnosis, and they're just putting this on social media, or especially if they have a large following, that's going to be harmful to people who really have it, because now we're going to think it's not a big deal. In some cases, people don't even think it exists. I've had friends who know me very well and know what I do and say, oh, I don't think ADHD is real. Now we're going against neuroscience, but that's a whole different topic. But you got to understand, ADHD is just not forgetting things and losing focus. It comes to the point where it's so severe that you can't get through daily life, and it's harmful to what you're trying to do. And when I say harmful, I mean more so it detracts. Like if you need to get something done, sense of just day-to-day living, and it can't be accomplished, then we get more into severity that where ADHD can be occurrence. But once again, you got to get checked for this stuff. Depression, I won't go too bit that because we talked a little bit about it, but once again, severity, duration. If you had a loved one or a family member, a dog or whatever die, that's horrible. But typically that makes sense to be sad, and it usually subsides after a while. Now, can it last longer than a few weeks, few days? Yes. But typically the fact is coming off of that event. So maybe there's underlying things and it continues for months, yes. But if it's just that event and it lasts for a few weeks, that kind of makes sense. Like I said before, if it's just a Tuesday, you're not going to do things you typically do. Typically, people think being depressed is just being frowning all the time. A lot of people walk around with depression with smiles on their face. The symptoms and signs could come way differently, because you got to look at changing eating habits, eating behaviors, weight, disposition, looking at things like, okay, what do they typically like to do? And if they're still doing it, because they typically like to do X, Y, and Z, and they're not doing that as much or as frequent, that's something to look into, because things that once gave them immense joy or day-to-day life, and they're just not doing that anymore, that's something to look into, because typically that's a sign that most won't pick up on because you won't even notice. Hey, when the last time you went fishing? I don't know, 8 months. If you know that person goes fishing every other day or does it all the time, and it's been 8 months since they did it, that's a sign maybe. Keyword maybe. You gotta look deeper, because there's 9 criteria, and I won't get into, like, say, I'm here to be more general, but we could get into the criteria and other topics later on another webinar. But basically, you got to look at that stuff. I change moods night and day. I'm so bipolar. Another misconception, because bipolar is not exactly just shifting moods night and day in a given moment, like today, tomorrow, or 5 minutes, 10 minutes. It's taking account that you've had a manic episode where you're elated, just overly going in charge, and there's no clear reason. You have at least one occurrence of that. Now, I guess I'm getting into a diagnosis. That's part of it. And then the other is you had at least that. So you got to understand that's where bipolar comes in. But then the other side, where say poles, because you're talking about high, there's the low lows, which is a major depressive episode. But you have to have the manic episode too, or it's just depression. So bipolar does more so with the moods of depression and mania, not just saying I'm happy, I'm sad, I'm fun, I'm boring, I'm on, I'm off. That's not what it is. And the last one, I have a split personality. I'm so schizophrenic. Now, this is wrong on so many levels, because schizophrenia, it means in translation split mind. So that's where people got the split personality. But that's actually something called dissociative personality disorder. And typically how that goes, they're oblivious to each other usually. They're called fugue states. So it's like you're not awake as the other person. If I'm Nicholas, then I also come John Boy. John Boy usually doesn't know about Nicholas, because Nicholas exists with Nicholas' world and John Boy exists in John Boy's world. But we're talking about schizophrenia. So schizophrenia is usually illusions and delusions, I should say, that come up when they're not really there, hearing things that aren't really there, having conversations in your head. And that's what schizophrenia is. And that's one of the more rarer ones. So that's why people who say I'm schizophrenic, I have a split personality, they should haha jokingly because they want to be funny. And that's fine. I know people don't really mean harm when they do that, but that's what it comes to. But yeah, so understanding, not colloquializing these things, meaning don't use them just to be funny because you had one day where you forgot something, or one day where you felt sad, or you think you're super neat, because it does more harm than good. And it really diminishes what it means for people who have to live through this. So there's so much information out there, guys. I'm gonna wrap up with this. And this is what mental health is all about. It's about having conversations and understanding what people go through. That way we all can live cohesively, because at the end of the day, there's way more people dealing with this than any other ailment in the world. So think twice next time when you give someone a hard time, or what they may or may not be going through, because in your eyes they may be okay, but deep down they may not. And it takes no time and costs no money to be a good person. Get your mind right.